Hey y'all, Dr. J here, your friendly neighborhood medical marijuana doctor. This will be part 2 of the video on CBG or Cannabigerol. Here I will talk about the things that CBG does do, including pain relief, vasodilation, neuroprotection, and its anti-inflammatory mechanism. It is anti-inflammatory through COX receptors, kind of like NSAIDs, and then there's also a study that shows that CBD reduces colonic inflammation as measured by myeloperoxidase or MPO activity, as well as a decrease in IL-1 beta levels. Pain relief. So, CBG, like CBD, is an agonist at the TRPV1 channels. That's transient receptor potential channels. Now, TRPV1 channels are similar to TRPV2 channels, basically in that they cause pain when they're activated. Wait a minute. CBG and CBD agonize or activate TRPV1 channels. This is because when the cannabinoids bind to them, they become rapidly desensitized to further binding, and this functions to actually relieve pain, kind of like how capsaicin works. Now, lots of diseases involve TRP channel dysfunction, ranging from nerve pain, respiratory disorders, plenty of inflammation. CBG and CBD are the most strongly binding to agonized TRPV1 or terpenoid 1 channels to reduce pain. CBG is also a pretty potent agonist at central alpha-2 adrenergic receptors, meaning vasodilation and lowered blood pressure. However, I only found one study in mice that gave another heroic dose, kind of like the appetite stimulation study in rats. It was like 10 milligrams per kilogram, and found an acute drop in blood pressure, similar to the effects of the pharmaceutical drug clonidine. Now, these were not humans. The dose was ginormous, so I don't worry about causing hypotension, or low blood pressure from the CBG doses that we get normally in gummies, which are like 1 to 2 milligrams per. But don't quit your lisinopril, okay? But it should be noted. Last but not least, CBG is also an agonist at the PPAR, PPAR, or peroxisome proliferator activator receptors. It has been shown to reduce neuronal death and the severity of Parkinson's disease, Huntington's disease, multiple sclerosis, and amyotrophic lateral sclerosis, or ALS. Not cure them, but exert a protective, less harmful effect. If you want any of the studies for any of the things that I said in the video today or in the past, you just let me know and I'll send the link right over to you. In mouse brains, CBG has also been shown to reduce the inflammatory molecules TNF-alpha and IL-1 beta. So I think the next one will probably be on cannabichromene or CBC. If you have any questions, ask away.